Mummy makeover. What exactly is it? A very common request that I get. Well, first of all, let's start. What happens with the body of a woman during and also after the pregnancies? Well, first of all, most of the ladies, they gain weight, water retention, and also, of course, the baby inside of the tummy puts a lot of stretch and a lot of force on the soft tissue. And then after the birth, usually when they breastfeed, of course, also the breast gets bigger. And then once all the volume disappears, because the ladies, they lose their body weight, in most of the cases, they recognize a lot of soft tissue laxity. So the areas which bother them most are mainly the tummy and also the breast. And for a typical mummy makeover surgery, usually the tummy is addressed, the breast is addressed, but also some other parts where ladies recognize some fat depots that they cannot handle by themselves. Now I will go through those different type of surgeries and describe it to you and also mark it on one of my cases. As you can see here in this case, this lady, after the birth of her kid, she had a lot of soft tissue laxity, mainly in the lower part of her tummy. And this is something that she cannot handle by herself. Even with a healthy lifestyle, with losing body weight, etc., it's impossible for her to reduce this soft tissue laxity, mainly in the lower part of the abdomen. So what I recommend to do is a so-called abdominoplasty. What does it mean? That means it's a combination of liposuction with tummy tuck. I always combine it with a liposuction because with a tummy tuck, I can remove the soft tissue laxity in the lower part of the abdomen, but if I want to address also the other areas, for example, the upper part of the tummy, the hips, the flanks, and also the back, then I definitely need also a liposuction. So the tummy tuck is usually done with an incision in the lower part of the abdomen. As you can see here, the blue line. So this is the lower incision. I place this incision very, very low, so afterwards, when everything is healed and they wear the underwear, the scar is hidden under the underwear. The second incision is above the belly button, usually. This is a full tummy tuck. There is also a so-called mini tummy tuck where I resect or remove only the skin tissue in the lower part, but the full tummy tuck is when you cut also above the belly button. And then, of course, I also have to detach all the skin also underneath from the muscle up all the way to the rib cage, because only then I can pull the tissue down. If I'm not releasing the tissue in the green marked area or to the green marked area, then the skin will be still attached to the muscle and I cannot pull it down. Therefore, I have to detach the tissue from the muscle to pull everything down. And this is the way how you do a tummy tuck. You pull everything down and then you stitch it. And at the end, the scar will be here in the lower part of the tummy, the red line. This is the final scar. And of course, they will also have another scar, which is around the belly button. Otherwise, the belly button would be here in the lower part of the tummy. And we don't want that. Therefore, I have also to replace the belly button. And there are different techniques on how to replace the belly button. My aim is always to create the belly button as natural as possible. Otherwise, if you look at the belly button, it could be noticeable that something is done. Therefore, it's important to do it in a way that it looks as natural as possible. It should not be completely round. It should not pop up. So therefore, I do it, for example, in a tent technique. Sometimes I recreate it. We call it neo-umbilicus, really a complete new belly button to make it as nice as possible. So in this case, also let's go back and have a look at the side view of the tummy of this lady. What you also see, beside the soft tissue laxity in the lower part and also the fat volumes that she has also in her back and in her hip area, in the side view, you see also that her tummy has a round shape, especially in the upper part. What's the reason? So the reason is that her muscle is not tight enough. We call it rectus diastasis, because during the pregnancy, what can happen is that the muscles separate, and afterwards, if they do not close properly, then you have a gap. That means the muscle is very weak, and the pressure behind the muscle, that means the area or the cavity where all the organs are, is pushing towards the muscle, and the ladies, they recognize a round shape of the tummy. And this can also be addressed during a tummy tuck. That means tightening the muscle, stitching the muscle to make it here as flat as possible. Making it flat, removing the fat from all the other areas. So the fat which I usually remove is from the hip area, from the flank area, of course also from the tummy, and then pulling everything down and doing the tummy tuck. By the way, the fat can also be used to re-inject it in other parts. For example, if they have a volume loss in the butt, I can use the fat, wash it, clean it, re-inject it in a very gentle way. Usually I do it also with ultrasound to keep it as safe as possible, to get at the end a nice silhouette. And it's important to create a nice transition from the waist to the hip down to the butt. Now let's go back to the final result of this case. So that was the plan, and this is the lady afterwards. As you can see, this is about 3 weeks afterwards. She has still some swellings, so I removed the fat from many parts of the tummy, of the hips, of the flanks. I did the tummy tuck. The lower incision is hidden under her underwear. Of course, there is still a scar visible around her belly button, but that will disappear. And a scar needs about 1 year until you see the final result, and that was just 3 weeks after the surgery. And this is her oblique view. And this is, by the way, one of her recent videos she shared with us through social media. She has a very healthy lifestyle. She's doing a lot of sports, and in combination, healthy lifestyle, doing sports, and of course the surgery that I did, it's possible to achieve these kind of results. It's hardly to imagine that this lady is exactly the same lady that you see in these pictures. Now again, also showing you a graph of what I do with the tummy tuck. So closing the muscle gap, pulling the tissue down, and then stitching it. Also here you can see it very nicely, how the muscle is tightened in the central part, and exactly. So you see how the muscle is tightened here in the central part. The tissue is pulled down, and then the final scar will be the red line, very low. This is the tummy tuck or lipoabdominoplasty. Now, the second part of a mummy makeover usually is the breast. And for the breast, usually what the ladies recognize is a so-called breast ptosis or mama ptosis. That means sagginess of the breast. So here you see different degrees of breast sagginess. The first one is the normal shape, and then the other one, as you can see, also the position of the areola is going down, 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 depending on how severe the sagginess is. There are many different surgery techniques on how to bring the gland back to the position where it was. But what they all have in common are the different type of scars that you have at the end of a lifting surgery. And these are the three different type of scars. We have a so-called O scar that you can see here on the right side. That means the scar is exactly around the areola. Most of the time when I just want to elevate the areola for not a severe sagginess, but just a moderate or minor sagginess. In case I have to reposition the gland, then we have a so-called I scar. That means it goes around the areola and then down to the lower breastfold, as you can see here on the left image, or a so-called T scar. We call it also anchor scar. That means around the areola down to the lower breastfold, and also another one in the lower breastfold. Inside of the breast, there are multiple techniques on how you can reposition the gland, bring it up. What I personally do and what I prefer is to do a so-called auto-augmentation. That means I'm not removing any parts of the gland, I'm just removing skin, and I use the gland and bring it up, their own gland, back to have more upper pole fullness. Of course, I will also bring the areola up. In some cases, if the volume is very, very small, we have to combine it also with an implant. Then it's augmentation, mastopexy, that means breast augmentation with an implant, and then the lifting surgery. So these are the two main surgeries for a mummy makeover. Tummy tuck with liposuction, breast lift, sometimes in combination with the breast augmentation with an implant. And what else can be done? The removed fat can be re-injected into other parts, for example, the butt or the breast, to create more volume. Just a short overview about the mummy makeover, and in one of my next videos I will describe you in detail the breast lift with the different techniques.